Welcome back. You're still watching Good Morning Namibia. As we continue off with the conversations, the Walvis Bay Corridor Group is extending its Roadside Wellness Clinic to support health and safety in DRC, Angola and Zambia. The Walvis Bay Corridor Group, with funding support from the SADC Secretariat and in collaboration with the governments of the Democratic Republic of Congo, Zambia and Angola. The Corridor Group is pleased to announce the opening of a new Roadside Wellness Clinic along the Walvis Bay-Ndola-Lubumbashi Development Corridor in DRC, which is the Kalumbesa border post, and in Zambia, the the Kasumbalesa border post, as well as in DRC, the Lufu border post, and Angola, the Luvo border post. Joining us this morning with more information on the Roadside Wellness Clinic is Edward Shivute, who is the project manager of the Walvis Bay Corridor Group. Mr. Shivute, good morning.
Good morning. Thank you for welcoming me.
Thank you so much for making time to talk to us.
Thank you.
First things first, can I just explain the main objectives behind expanding the Roadside Wellness Clinic to these specific regions?
So these roadside wellness clinics, they came about because we started with the concept in 2012 with the support from SADC. And we started basically in Namibia, where we have roadside wellness clinics in 7 of the 14 regions. But then, on a SADC level, maybe just to give you a bit of context, in 2003, the health ministers from the region, they converged in Lesotho, Maseru. And then they were debating and strategizing on how to address the key health challenges of mobile populations within the region. And what came out of there is, by the way, the population of SADC is about 400 million. Mm-hmm. And at the time, according to UNAIDS global reports, we had about 26 million new infections for HIV. And also about 640,000 new infections at the time per year. The trend is actually still continuing. And the SADC region alone contributes about 37% of the global infection rates for HIV. And as you know, the SADC in terms of population comparisons only contributes about 4% of the global population. So it's a very small population, but with high rates of HIV infection. What we are seeing now is an increased cases of emerging diseases like cancer, hypertension, and what is now, after that meeting in Maseru, the ministers ratified what is now called the Maseru Declaration of 2003. And that is basically then to address the key health issues, and which is basically to address the key health issues along within the region, mm-hmm. but most importantly, targeting specific groups of people who are the mobile population, because normally they are left behind in terms of accessible healthcare.
All right. Can you just talk to us about the process of identifying the need for clinics, specifically in the DRC, Angola, as well as Zambia?
Yeah. So, like we said, this is basically for us as an organization. We are following what we call the transport corridors. As you know, our transport corridor starts at the port of Walvis Bay all the way into Zambia, Sesheke, and then to Kasumbalesa, DRC. So through our engagements with SADC, we also extended the engagements to member states because of the statistics I just mentioned. And we realized that there is a need for a multi-sectoral approach in order to address these health issues. And the process then entailed us engaging these member states, and also to look at their country priorities, because each country has their own priorities when it comes to health matters. So by engaging with these members and SADC, we then look at what strategies can we put in place. And for us, we realize that the best strategies for this community is basically to to implement or establish what we now call roadside wellness clinics, because you will realize that the workplace of mobile populations such as drivers is actually on the road and not in a building.
Yeah. Earlier on, you mentioned a few diseases such as cancer, hypertension, and HIV. But what are some of the specific health services that will be provided at the roadside wellness clinics?
We advocate for a comprehensive health and wellness package. So we are looking at both communicable diseases such as HIV, malaria, TB, even COVID, as we know. But also we are looking at other non-communicable diseases like your cancers. Cancer is now an emerging disease burden for many member states within the SADC region, whether it's lung cancer, breast cancer, prostate cancer, and now most important, the cervical cancer. So, but our approach is quite holistic and comprehensive, because, you know, when we started then we were focusing on HIV/AIDS, but you will realize that most of the member states now, they have over 50% hypertension cases. And this is, you know, stress levels within the region due to other social determinants like, you know, unemployment, poverty, climate change issues have also come into the picture now.
All right. I mean, obviously the aim of the roadside wellness clinic is for the health and safety of the truck drivers, right, as well as the cross-border traders. But how do you envision that these services also reach the local communities?
Well, in terms of our comprehensive approach, we do not only target one particular group, because, you know, populations within the SADC community, they interact with each other. And when you look at the life of a truck driver, when they come to a certain border post and there are delays, they are more likely to interact with, you know, other cross-border communities. So what we envision to see, number one is you know, a reduction in health disease burdens in the member states, and also most importantly access to healthcare, and not only you know, people accessing healthcare, but also utilizing those healthcare, because it's no need for us to put up all these, you know, structures and have all these good services, but there is people are not utilizing the services. Yeah. So we do that through promotion, advocacy, and raising awareness about, you know, the importance of these services.
All right. What challenges do you anticipate in implementing and sustaining some of these clinics, and also how do you perhaps plan to overcome them?
Yeah, first of all, we want to thank the SADC Secretariat through the HIV fund that was, you know, started through the Maseru Declaration. But the challenge for these very good projects remains resources, financial resources. The infrastructure is quite stable once it's set up, but to sustain it, you require financial resources. This is where we also engage our development partners. We also know that most of the transport industry operators, their employees, this is private sector. So their modus operandi is based on profit making. So there is also a need for us to engage the private sector more, but most importantly also to engage the member states so that we you know, reach regional integration in terms of our initiatives and goals. And this is really what we are aiming for. So it's about engaging very key stakeholders.
All right. And how does this whole initiative fit into the larger context of health and safety in the Southern African region?
Well, you know, at SADC level, there are protocols, various protocols on how to deal with emerging health issues within the region. You will recall that during the time of the COVID outbreak, there were even more protocols that were, you know, ratified by member states and, you know, developed, and most of them are still active. But what we see is that we want, through obviously the multi-sectoral approach and stakeholder engagement, we want to see a situation where there is harmonization of different strategies within the region. It will not be easy because, like I said before, Each country has their own priorities in how they want to deal with health matters. But as a region, what we have in common is to address issues, social determinants, and we address that through economic growth for the region. But you cannot talk about economic growth when you have an unhealthy community. So that is where we come in to say, we have very good protocols, very good frameworks at country level, at SADC level, and even global level that are informing our decisions and programs, but we need to implement them. We need to implement them. We need to involve everyone in the process. We need to make sure that the outcome is based on improved health services. Also infrastructure, in some parts of our region, there is a problem with sustaining good infrastructure. But also just to mention that research for us is very important to understand different situations. The scope we started with back in 2012 with the SADC project was very small. But over time, it has increased. The scope has increased, and the resources gradually also increasing. But at that level, we really want to see a multi-sectoral, engaged approach.
All right. Well, Mr. Shivute, thank you so much for joining us this morning. We love the work that you're doing for the community, and all the best with your future endeavors.
Thank you so much. Appreciate it.
All right. Well, Good Morning Namibia continues shortly after this. Don't go anywhere.